Welcome, everybody. My name is Michael Barasch. I'm one of the partners here at Barasch McGarry, lawyers for the 9/11 community, and we're delighted to have this webinar this morning about prostate cancer and the 9/11 community. It is the second most common cancer among the 450,000 people who were exposed to the World Trade Center toxins. With us this morning, we have Liam Lynch from NICOSH, and I'll let Liam introduce himself in a few minutes. We have Dr. Billy Ding and Dr. Mutahar Ahmed, two urologists who are going to talk a little bit about prostate cancer. We also have Craig Pinto from ManCave Health. And then we have several of the partners from my law firm. So there's a lot to cover. I'm going to get right into it right now with the video.
The first thing that I hear from the non-first responder community in Lower Manhattan is, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
Let's get right into it. Liam, I'm going to start with you this morning. Liam is from NICOSH. Would you introduce yourself and tell us what NICOSH is?
Thanks for joining us today. I'm Liam, here with the New York Committee for Occupational Safety and Health. It's a mouthful. We just go by NICOSH, and we're a nonprofit advocacy group in the city. We work with unions, worker-centered organizations to help fight for safe and healthy jobs in New York City. And part of our history has been working with the 9/11 responder and survivor community. NICOSH was there in the early days, and we really helped lobby for the passage of the law that created the 2 programs that we're going to talk about today. So really happy to be here.
Okay, so Liam just said that there were 2 programs. So we were down in Washington. We've been there since 2001, advocating and lobbying for the passage of the James Z. Roga Health and Compensation Act. And when Congress passed that at the end of 2010, it created the World Trade Center Health Program, which provides free health care nationwide to anybody with a 9/11 related illness, including, by the way, mental illnesses, and Liam will talk about that in a minute. It also created the Victim Compensation Fund. Many of you, I'm sure, saw Jon Stewart with us in Washington last year. Well, it's more accurate to say we were with him, because if it wasn't for John, this never would have happened. The truth is we needed a celebrity, and Congress did the right thing and has extended free health care and compensation to those with 9/11 related illnesses for the rest of everyone's life. The most common cancer is skin cancer. After that, because the toxins were so bad, the second most common cancer is prostate cancer, which leads us today to Dr. Ding and Dr. Ahmed. So why don't we start with Dr. Ding, and then we'll go to Dr. Ahmed, and then we'll come back and discuss the law and the health program.
Thanks for having me. Good morning. I'm Dr. William Ding. I'm a radiation oncologist, and I'm also the medical director at the New Jersey Urology Cancer Center in Lawrenceville, New Jersey. And we specialize in prostate cancer, bladder cancer, any genital urinary cancers. And today what I would like to do is give you a broad overview of prostate cancer. So just to start out, prostate cancer is actually a pretty widespread problem amongst men. In this country alone, about 200,000 cases of prostate cancers are diagnosed each year. So one of the strongest risk factors of developing prostate cancer is having a strong family history of prostate cancer. Typically, men are diagnosed in their 60s and 70s. The good thing is a vast majority of these cancers are diagnosed at an early localized stage, meaning the cancer has not spread to the other parts of the body. So you all have heard of this, right? The PSA. So it stands for prostate-specific antigen. It's actually present in a small amount in healthy men. What it does is that it makes sperms mobile. So the question is, what happens when you have an elevated PSA? So by definition, an elevated PSA is anything above 4. There is actually a bunch of other things, non-cancer related conditions that can elevate your PSA, including an infection of the prostate or enlarged prostate. But the thing that we worry about the most, obviously, is prostate cancer. The good thing is prostate cancer is one of those few cancers that we actually have a good screening program for. And this includes a digital rectal exam and annual PSA blood test. Starting at the age of 50 is when men should start having their annual PSAs checked. And it will be younger if you actually have a higher risk of developing prostate cancer. So the question is, what do you do when you have an elevated PSA? Well, one of the first things that we should do is rule out the non-cancer causes of an elevated PSA. You repeat another PSA, and if it's still elevated, we should think about doing a biopsy. Now, once we diagnose someone with a prostate cancer, we generally place the patient in one of 3 categories. And this includes a low risk, an intermediate risk, and a high risk. And it's important to note which risk group you belong to, because that drives the treatment decisions. And the 3 factors that we use to make this determination are the level of your PSA, how high it is, the stage of your cancer, and something what we call the Gleason score, which is actually how aggressive do these cancer cells look under the microscope. According to the NCCN guidelines, a patient who has a low-risk prostate cancer, because they do so well, one of the management options is to continue to watch this for now. It's called active surveillance. It means to continue getting your PSA and repeating biopsies once every so often. And it's not until we see something more aggressive where we then say, okay, let's do something about it now. It's also appropriate to start treatment at that point. Radiation is an appropriate treatment, either with a non-invasive radiation called IMRT, or an invasive radiation called the radioactive seed implant. And of course, removal of the prostate or prostatectomy is another appropriate option. For intermediate risk cancer patients, while a small subset of those patients can still be watched, most patients would opt for getting definitive treatment with either radiation or prostatectomy, just because these cancers are now obviously more aggressive. And for high-risk prostate cancer patients, the options are either surgery or radiation therapy with long-term hormone therapy. That's pretty much it. Now, just to recap, I think what I want to convey to you is that while prostate cancer is a big problem amongst men, most of these cancers are diagnosed at an early localized stage, meaning the cancer is still very curable. And that screening for prostate cancer plays a big part in detecting these cancers at an early stage so that we can jump right in and get it.
Thank you, Dr. Ding. And I just want to echo something that you just said about it being totally curable. I mentioned in the video that I'm a cancer survivor. It happens to be prostate cancer. I am in the active surveillance stage, and I hope to stay there for a long time. But I go every 6 months for my PSA. My doctor also has me doing MRIs once a year, and I'm hoping to stay that way. Dr. Ahmed, can we go through your slides now, please?
Thank you. Good morning, everyone. And I would like to thank our host for really putting out this program. And I think this is very important. So here we go. I work mainly at Hackensack. I'm part of the NJU, New Jersey Urology. I also a director for the Bladder Cancer Center. We also do a lot of teaching at the medical school at Rutgers and Hackensack Meridian Medical School. So this slide kind of sums up what Dr. Ding discussed. And what I'm going to try to convey is that, prostate cancer is real and it affects a lot of men. And if you live long enough, you will get prostate cancer. However, the one that we really want to know are the earlier ones, the younger ones. And this slide kind of shows that 1 in 9 patients will be diagnosed with prostate cancer in his lifetime, 1 in 9 men. And 1 in 41 men will die from prostate cancer. So they can live on for years with appropriate treatment. And this slide also, again, demonstrates that it is a disease of men in their 60s and in their 70s. However, the men below 50 can get it, as you can see from this slide. If they have a risk factor associated with them, they're at a higher risk to develop prostate cancer at a younger age. However, for most men, between 60 to 80 is the key time that they get diagnosed. What we know about carcinogens. So we know from Vietnam vets that they're at a high risk for prostate cancer because they were introduced to Agent Orange, which, as you know, these are defrustration agents known to be associated with prostate cancer. And I worked at the VA, and the VA does give compensation for vets who has served in Vietnam and who has developed prostate cancer. And the VA system is such that they would not give money or compensation if there is no direct association. So we know Agent Orange does have association with prostate cancer. So how does that fit in with the Twin Tower and the disaster site of 9/11? So what burned in the jet fuel and then the tower that fell, it contained a lot of the carcinogens that are known to us, which is benzene, asbestos, cement, PCBs, dioxin, you could name it. Everything was in there. And especially with the burning jet fuel, it just created a big carcinogenic factory. And what these agent causes inflammation. And in men, the prostate cancer is like kind of ground zero for inflammation because the prostate is a very sensitive organ, part of the human body. And these inflammation can lead to prostate cancer. So that's the theory behind how these carcinogens causes cancer or inflammation in the prostate. And what we know that Dr. William O, who is an oncologist in Mount Sinai and an epidemiologist, they have studied this subject and they have published in molecular cancer research that increased inflammation cascade within the prostate, and this may have contributed to developing more aggressive prostate cancer. So not only that they can develop prostate cancer, but those individuals who are exposed to that 9/11 sites, they're at a risk for more aggressive type of prostate cancer. So this is what I'm trying to demonstrate here, that this is a real risk and we need to really pay attention to that. And we are observing not only prostate cancer, there are other type of cancer that we see, kidney cancer, lymphomas, there are other type of cancer that are associated. And when those patients present with those cancer, especially prostate, they tend to be more aggressive type. So this is something very important to know for the victim of the 9/11, the first responder of the 9/11. They really need to know this. So what is the bottom line? So the bottom line is men with exposure to 9/11 disaster, especially World Trade Center dust, needs to start screening for prostate cancer as early as age 40, because that's a risk factor. and the guideline can be started that those patient needs to get screened earlier. Diagnosis with prostate cancer doesn't always means that you have to get treatment. As our host indicated, that he's not getting surgery, he's not getting radiation, he got active surveillance, and he's on that, and he's going to properly monitor himself. And if his cancer does progress, then he's going to go to treatment. So that's the good thing about prostate cancer, that it is generally slow growing cancer, and we can actively do the surveillance and put a hold on any kind of treatment. And some of these patients, up to 50-60%, can end up not having to do any treatment for the rest of their life. But we need to identify those people, because those other 50-60% does need treatment, and we can treat them properly if we know they have the disease. All right, so the bottom line, especially if you're a 9/11 responder, you got exposed to those toxic dust, you need to get screened, and you need to find out your status, because the treatment option is available, and they're not as bad as one may think.
I appreciate so much your participating this morning. And this is something that we're always imploring our 9/11 community members to do. Early detection is the key, and help us spread the word. What my urologist has said to me is, Michael, you're not going to die of prostate cancer. You're going to die with prostate cancer, God willing. Anyway, Liam, let's go to you.
Yes, definitely. And thank you so much, doctors. The World Trade Center Health Program. So it's for 9/11 responders and survivors. So for both populations. And it's free, no-cost healthcare for this community that was exposed to all of the toxins that the doctor spoke about. And for responders, there is a free annual monitoring exam or visit. And so we're talking about how early detection can save lives. Well, for responders, they can come in, even if they don't feel sick, right? They can come in for their annual monitoring exam, and that definitely is life-saving. It's for physical health conditions. So there's over 100 different illnesses that have been connected to 9/11 exposure, including 68 cancers, with prostate cancer being one of them, but also mental health conditions. So, anxiety, panic disorder, PTSD, right? And we know that there's, responder and survivor population is not just dealing with physical conditions, but mental health conditions as well. And this treatment is, is inclusive of all your medical tests, doctor visits, your surgeries, prescription drugs. And like Michael was saying earlier, it's not just, this program does not just exist in the New York City area. As we speak, there are responders and survivors receiving care in all states across the country, including Puerto Rico. So you do not have to live here in order to receive care. And the reason this program is so special is because it's specialized treatment. The healthcare professionals and the doctors that are in this program are specialized in treating this community, who understand the unique circumstances of the conditions and have just a plethora of experience that really makes this program stand out and is worth the time to enroll just alone. But there are many other reasons to enroll. And also, this program is not static. If you opt in, your patient data can be used for extremely valuable research that can help us care for responders of disasters and exposures in the future, and care for this particular population in the future. And that's only if you choose to, but don't take this lightly. By participating in this research, you're helping, and you're doing a service to this country, and you're not taking away anything from anybody. This program was built by and for you. So, I know a lot of responders and survivors go, I don't want to take care away from someone. That's not the case here. And also the program offers excellent benefits counseling. So really it's a wholesome, comprehensive care that they're delivering. So when I first started doing this work, cancer was not covered. And now, 8 years later, cancer is definitely covered. Right now, the big thing is, getting autoimmune diseases covered potentially in the future. So the more people that we have in the program, the more data is going to be useful for researchers. There are different eligibility requirements. Also, these two programs. So I spoke about healthcare, but there's also the compensation piece. they require separate enrollment and registration processes. So for survivors to be in the healthcare program, the eligibility is if you were south of Houston Street, into parts of Brooklyn, like Brooklyn Heights, but that's very sliver right there. And then for responders in the healthcare program, it's below south of Canal Street, and also the landfill in Fresh Kills in Staten Island, and also some barges. And then to be a part of the Victim Compensation Fund, so that compensation program, it's below Canal Street. You can see that it kind of parcels out a little bit more than the for the healthcare program. Basically, you have to get your conditions certified by the healthcare program in order to file a successful victim compensation claim, which we're going to talk about.
Right, and I'm so glad you brought me to that, because that does bring me to Lee London, one of my partners who's on today. Lee, would you please explain the difference between a responder and what exactly is a survivor?
Sure. So there were a lot of different first responders and survivors exposed at the World Trade Center site and at the Pentagon. So the World Trade Center Health Program not only covers, Ground Zero area in Lower Manhattan, but also Pentagon exposure as well. And as Dr. Ahmed was speaking about with the carcinogens from 9/11, it's the presumption that your prostate cancer was caused by your 9/11 exposure. The first question I always get from people is, my father had it, my grandfather had prostate cancer, my private doctor doesn't know much about my 9/11 exposure. What do I do? I want to encourage everybody who believes they have 9/11 exposure and who was there during that time to go to the World Trade Center Health Program and be with the doctors that know 9/11 exposure at the health program, because the many misconceptions is that it's family related, but no, just like with Agent Orange in Vietnam, it's the presumption that your prostate cancer was caused by your 9/11 exposure, and we want to help you. There's no free lunch like Dr. Ahmed said, but what we can do is make your lunch comfortable with the Victim Compensation Fund and the benefits available. We want to make sure that people take advantage of it. And out of the over 500,000, people impacted by 9/11 exposure, there are first responders and survivors. The survivors are the ones that worked, that lived there during the time, that went to school. We have a 34-year-old prostate cancer client that was a sophomore in Stuyvesant High School during the time. So, these cancers are much more aggressive in the 9/11 community. We just want to make sure survivors and first responders are taking advantage of it.
That's great. I want to introduce Craig Pinto. Craig is with ManCave Health. Craig, would you tell us a little bit about your organization?
Sure. Thank you, Michael. So ManCave Health, we're focused here. Our mission is to raise, construct, and operate ManCave facilities. Right now, we open our first ManCave facility at Mount Sinai, Department of Urology. We're also working to raise money to offer free health fairs and free cancer screening events throughout the year. We are working with Barasch McGarry to host our first one in 2021, which will offer free cancer screenings to all 9/11 survivors and responders as well. And really the basis of our mission, we provide an opportunity for resources and refuge for men really to get comfortable, to get the latest education and diagnosis and treatment. And essentially through support, ManCave Health is really looking to, and we're committed to, changing the landscape of men's health and making it more comfortable to get tested and comfortable for men to get treated.
All right, well, thank you. I should say, Liam talked about the free healthcare. The Victim Compensation Fund is giving between $200,000 and $250,000 tax-free to those who are diagnosed with and certified with a 9/11 related cancer, such as prostate cancer. When Jon Stewart and we were lobbying last year in Washington, we got this Victim Compensation Fund and the healthcare before that extended until 2090. We argued to the special master, wait a second, so many people didn't realize that they were entitled to these benefits. You have to give them a chance to register, because so many people, even if they knew about it, they were afraid that they were taking things away from firefighters and police officers. They didn't want to take money away from them. So now that the fund has been fully extended, the special master made a wonderful decision, and she extended the deadline for anybody who had got diagnosed with cancer more than 2 years ago, or anyone who died from cancer more than 2 years ago, or a respiratory illness. They now have a chance until next July 29th to register a claim. Please, if you're listening, help us spread the word about this deadline. I am sure there are so many widows and family members, especially those outside of the New York area, who have no idea that, as John Stewart said, access what you are entitled to. You are entitled to this compensation. So Dom and Dana, would you talk a little bit about the benefits, please, of the family assistance team?
Absolutely, thank you, and good morning, everybody. With respect to deceased claims, it can include not just an award for the passing of a person, but also if they didn't, as we've just been saying, if they didn't take advantage, if the deceased person didn't take advantage during life of the fund and didn't file a claim for personal injuries, their family still can as part of their deceased claim. So the family can get an award for loss earnings. If the person was incapacitated by their illness from their job, the family can get pain and suffering that the person experienced while he or she was alive before passing away from their 9/11 related illness. And as part of the deceased claim award, the family can get additional lost earnings. The family can get additional pain and suffering that their deceased one went through. The family can also get compensation for what's called replacement services, for the things that their loved one used to do for them, perhaps did around the house, the chores that they did, the way that they contributed to the household, the things that they did for one another. When a person passes away, obviously somebody else has to do those things or pay someone to do them, and the fund recognizes that and it provides compensation for that. And it also provides compensation for funeral costs. It reimburses that. And if a person passes away and has dependents, each dependent is entitled to a separate award, an award for $100,000. When you add up all of these different categories of damages, awards can be very substantial. They can be in the hundreds of thousands of dollars. They can be in the millions of dollars. The fund is a very good program. And Dana is going to talk about some of the special issues that pertain to these deceased claims and what you can do for your family, what anybody can do for their family who is a member of the 9/11 community now.
Doing this work, helping families who've lost someone to 9/11 disease, we have learned some very important lessons about what all of us in the 9/11 community can and should be doing to plan for our families. So I want to talk to you about those things, a few of them. The first and most important thing is that you have to talk to your family. You cannot leave it to them to stumble upon this by themselves, because for us, many of the families who come to us come years and years and years later. And when someone has lost someone, they need help now. They need it immediately. They don't need it years later. So make sure they know. And make sure they understand that even if you applied during your lifetime, they still can apply for benefits of their own. Make sure they understand that there's a presumption and that a doctor doesn't need to say your illness was caused by 9/11. If you were there and you have one of the covered illnesses and you pass away from that illness, your family will be entitled to these benefits, but they have to know. So talk to them. The second thing that you should do is get in the program. And if you are sick, register a claim with the VCF, file that claim, because the VCF will make a determination about whether you're eligible based on your exposure. And if you do that while you're alive, your family will not have to do that later, and the process will be much faster for them. In any event, if you're not going to do that, find witnesses. Most people need 2 witnesses in order to receive compensation from the Victim Compensation Fund. Those are ideally witnesses who saw them there. It's going to be a hard thing for your family to do. They weren't there with you. They don't know who was there with you. So you should locate those witnesses. If you need affidavits, we can provide those for you to give to the witnesses. And that's something you should do for your family. And the last thing I'm going to tell you is that we all should have a will, because the difference between a family dealing with this process where there is a will and a family dealing it with when there isn't, it can mean an extra year. You know, it can add so much time to the process. So get a will. You can name your executor. That's the person who'll be able to bring this claim. That will ideally be the person you've spoken to and made sure they know about the claim. Part of the award will pass through the estate, and that means you get to decide where some part of this award goes, and you know where it's most needed. If you don't do that, it's going to pass by intestacy. It's a formula, and it may not be what's best for your family. So that's the short version of things that you can and should be thinking about now.
We are urging everyone in the 9/11 community, even if you are currently healthy, secure your evidence that you were either working downtown or living downtown or going to school downtown, or you were a responder or a volunteer. They in particular have a tough time. It's not going to be any easier 10, 20, 30 years from now if that's when you get your cancer. So it's almost like a life insurance policy. Register now for both the health program and the Victim Compensation Fund. Get your proof of presence, your proof of exposure, just to protect yourself. God forbid you ever get sick. I want to circle back to Lee London, who's going to talk to us for a minute about some of the personal injury awards that the Victim Compensation Fund has been giving. Lee?
Yeah, sure. So you have the World Trade Center Health Program on one side, and you have the Victim Compensation Fund on the other. So some benefits of the Victim Compensation Fund are out-of-pocket medical expenses, and this is a big one for families in the community of 9/11 exposure, is if you paid for treatment that wasn't covered by your insurance and you're not part of the health program yet, we can make a claim directly to the Victim Compensation Fund to get you reimbursed for your out-of-pocket medicals. They add up, especially with this cancer treatment. Now, you can have, just like the doctor said, one person going through prostate cancer and they just wait and see, and you can have another person going through prostate cancer that has horrible severity, incontinence. So the awards range based on severity. When the Victim Compensation Fund awards you for a non-economic loss claim for pain and suffering, they look at if you've had surgeries. They look at every claim individually. And if you get a $200,000 award for prostate cancer, and then 5 years later, your prostate cancer gets worse, we can amend your claim for an increased award. You're never waiving any future legal right by accepting an award from the Victim Compensation Fund. That is the best part of this program that has been extended to outlive us all, because cancers develop later in life, and we don't want you starting this process when you're sick. We want you starting it when you're healthy to go in for evaluations, and then you'll have this there as a benefit to you. God forbid anything comes up. Other than just non-economic loss for pain and suffering, we could make a loss of earnings claims. Many of our teachers, our firefighters, our cops, our sanitation workers lose their jobs due to their conditions. And we can make loss of earnings claims directly to the Victim Compensation Fund, which is a huge safeguard for the family. And it lets you have your treatment and know your family's being taken care of, because that is why these programs are available to you. And that's why we lobbied Congress so hard to get them permanently funded and extended.
Thank you, Lee. And I just want to add, and we wouldn't be doing our jobs as advocates in the 9/11 community if I didn't just speak frankly about this. It's not just you don't just have the ability to amend your claim if your prostate cancer gets worse, but we see so many claimants with multiple aggressive cancers. So if you are awarded compensation for prostate cancer now, and later on you develop skin cancer or lung cancer, you can make a claim. And as Dom and Dana both alluded to, and if God forbid you die of your 9/11 related illness, your families can make a claim for your wrongful death. So thank you all very much. Feel free to reach out to us. We're here as a service, as advocates. Even if you have another attorney, we are happy to answer your questions. We are passionate about helping you, and it is our pleasure to be here today.